So yeah, first of all, if you could just explain what concussion actually is.
Okay, concussion is an injury to the brain. It can happen from a relatively minor trauma, and it's probably characterised by not having any visible damage to the brain, but there's often a transient loss of function. So the patient undergoing concussion will typically show signs of confusion, drowsiness. They may have a loss of consciousness. And usually the brain will recover from that on its own within a time frame.
Okay, so what are the more long-term effects of regular and serious concussions?
The worry with concussion is that although there's no visible damage, there is biochemical damage to the cells of the brain. And if there's a second trauma, when the cells are in that already damaged state, then they can undergo irreversible damage. Serial injuries can lead to more and more progressive damage, which can be permanent.
So what is it about rugby as a sport that makes concussion so common within the game?
Rugby is obviously a very physical contact sport. There are lots of collisions. Even with a tackle that's performed well, there's a chance that the player being tackled can fall to the ground and hit their head on the ground. Certainly a tackle that's performed badly will involve the player getting their head in the wrong position, which can lead to them getting direct hits on the head. There's also contact throughout the rucks and mauls, and again, at any point, contact between heads is quite possible.
So I spoke to you before we set this interview up about the group of doctors that want to ban full contact rugby for anyone under the age of 18, but they've sort of changed their campaign now to just ban contact above the waist for anyone under the age of 18. How do you agree with those group of doctors? What's your stance on?
I can understand where they're coming from, and the thought of young players having repeated injuries is worrying. But a blanket ban on tackling is probably not the way to go, as that will lead to them not developing the correct technique for tackling at a young age. And certainly the force of the impact as players get older becomes much, much greater. There is a chance for them to develop their skills better at a younger age when the force of the impact is much less.
Just quickly, I know I didn't tell you this question before we set up, but I spoke to last week is a kid called Alex Coe. He's 14 years old and he's suffered, I think in the last 5 months, he's had 3 concussions. What's his risk of developing a serious condition when he's older, now that he's getting concussions quite regularly at a young age?
I think it's difficult for me to give a figure on that, on how likely that is. We certainly know that repeated concussions before the brain has had a chance to recover can certainly cause permanent damage. The actual percentages and likelihood of him having further brain damage, I can't tell you from the top of my head.